My name is Sekaich Koero. As the Vice President of Programs at Engender Health, every day I see the lasting impact of our projects on individuals and communities that we serve. Engender Health achieves this impact by working holistically to address health not only at the individual level, but at the community, systems, and policy levels. We pay special attention to ensuring quality in our programs, prioritizing local leadership to promote sustainability and reaching underserved populations, including youth, people with disabilities, and rural communities. Our achievements are amplified through partnerships, learning, and leadership, and through our emphasis on organizational effectiveness and gender equity, which accelerates our impact. During the 2023 fiscal year, we operated in increasingly complex environments, including humanitarian settings, and we implemented high-quality sexual and reproductive health and rights activities through 23 projects across 16 countries. Through these projects, we supported millions of people with services and information related to maternal and obstetric health, abortion, contraception, gender-based violence, and more. Now over to you, Danielle, for more about our impact.
I'm Danielle Garfinkel, the Associate Director of Monitoring, Evaluation, and Learning. This year, we supported high-quality contraceptive and comprehensive abortion care services for an estimated 1.1 million people. Through this support, we generated almost 3.5 million couple years of protection and averted an estimated 1.68 million unintended pregnancies. We also averted thousands of maternal deaths and unsafe abortions, and our work contributed to saving an estimated $157.7 million in direct healthcare costs. In fiscal year 2023, we worked directly with governments to substantially contribute to 18 new policies, strategies, or guidelines that promote gender equity, ensure access to sexual and reproductive health services, or support sexual and reproductive health and rights more broadly. For example, in Ethiopia, our team worked with partners to support the development of the National Health Equity Strategic Plan. Engender Health contributed substantially to the new plan by sharing lessons and insights from implementation of our own interventions with under-resourced groups. At the systems level, we continue to work with and through governments and other partners to achieve sustainable and equitable health impacts in support of universal healthcare and primary healthcare. One of our focal areas is increasing the availability of skilled healthcare providers and cultivating capacity at the community level through training. This past year, we trained over 100,000 clinical staff, community health workers, community leaders, youth, and health administrators in a range of topics. Through the USAID-supported Momentum Safe Surgery and Family Planning and Obstetrics Project, which strengthens the maternal health safe surgery ecosystem across 9 countries, we focused on scale-up of activities, supporting over 1,200 healthcare facilities to provide high-quality maternal and obstetric healthcare. This year, we expanded project activities, such as supporting clinical mentorship, to ensure that women in need receive high-quality, medically indicated obstetric surgeries. A critical component of strengthened healthcare is ensuring collaboration across different health areas and more broadly across sectors to allow for integrated programming. Strong health systems and integration are particularly critical in humanitarian settings, and this year, Engender Health worked in a growing number of these contexts to improve community and system resilience. For example, in Mali, through the Kenya Nyata Project, Engender Health operated in regions of political insecurity to promote gender-integrated messaging on contraception, newborn care, malnutrition, malaria, immunization, and water sanitation and hygiene. We did this by supporting more than 900,000 households through educational home visits. At the community level, this year we reached over 1.6 million people with information on contraception, abortion, maternal, newborn, and child health, and many other topics. The example here shows our community-based education in India, where youth champions discuss gender-based violence-related issues, including the role they can play in identifying and referring survivors to care in their communities. Beyond supporting policies, health systems, and communities, we prioritize the individual who is at the core of all of our work. This is Muskan, a teen who served as a peer educator with our Tarunya program in India. Through our program activities and trainings, Muskan grew her confidence and ability to discuss sexual and reproductive health issues with her peers and became a master trainer for new peer educators. Her work gained her external recognition and receipt of a scholarship from the Youth Dreamer Foundation. Muskan's journey is a testament to the power and transformative impact of youth agency around sexual and reproductive health. In addition to impacting individuals through strengthening agency, shifting attitudes, and providing critical sexual and reproductive health and rights information, our project supported women with the provision of more than 21,000 high-quality, comprehensive abortion care services and with 89,400 safe obstetric surgeries. We also supported care for survivors of over 127,000 incidents of gender-based violence. As an organization, we also foster learning, leadership, and partnerships, since these domains cut across and enhance all of our results. This year, we led the way in advancing the global conversation to prioritize locally led program planning, decision-making, and implementation, working with colleague organizations to complete the first phase of the Transforming INGO Models for Equity, or TIME initiative. Through this initiative, which explores how we can best partner on sexual and reproductive health and rights priorities and shift our operating models to increase equity, we identified characteristics of equitable partnerships, as well as recommendations to shift these dynamics. We are proud of our achievements, and as we look to the coming year, we will continue to track and report our critical contributions in improving the health and well-being of people globally. Please visit our website to learn more about how we do this. Thank you.